I want to talk about lymphedema. Lymphedema is an unrecognized and underdiagnosed condition that a large population is suffering from. My name is Abby Malport. I'm a certified lymphedema therapist, physical therapist assistant, licensed massage therapist, and certified personal trainer. I'm the owner of Fluid Motion Massage in Green Bay, Wisconsin. Lymphedema is a lymphatic system dysfunction. And if you don't know what the lymphatic system is, I encourage you to go back and listen to my video on the basic overview of the lymphatic system. Lymphedema is a chronic inflammatory condition. Unfortunately, once you are diagnosed with lymphedema, it is something that you will have to deal with for the rest of your life. There is no cure for lymphedema. It is an excess water and protein accumulation in the tissues. This accumulation leads to the edema or swelling. And as a result, you will see an increase in limb size. That can either be the arms or the legs, or in region size, which could be head and face lymphedema or truncal edema or swelling. With lymphedema, it's characteristic to see skin changes, which can lead to fibrosis or a thickening of the skin or hardening of the skin, increased skin tightness. You often see that shiny, glossy texture to the skin when the skin is stretched to its maximal capacity. And this can eventually cause weeping, where a little break in the skin can cause a weeping of fluid onto the skin. After 60 days of protein-rich fluid trapped underneath the skin, this is what leads to the skin changes. So it only takes 60 days of an increase in edema, protein-rich edema under the skin to lead to skin changes, noticeable skin changes in our body. Lymphedema is a chronic disorder that often goes unrecognized and underdiagnosed. There's not, unfortunately, a lot of knowledge out there in the medical field. And that's what I help to do with some of these videos, is to help educate the population on these disorders and how we can help. Lymphedema does not develop overnight. There is a gradual onset. Once the process starts, it continues to worsen unless it is treated. And with the later stages of lymphedema, quality of life is often greatly impaired, which can result in difficulty moving around, inability to work, poor hygiene, infection risk, and eventually bedbound status. People with advanced lymphedemas often struggle with multiple bouts of cellulitis, which is a painful condition of an infection that can lead to septicemia and death. Here are some generic pictures of lymphedema. The most common sites are the legs and the arms, which you can see here, but it can also occur in the head, trunk, organs, and or genitals. And true lymphedema is often unilateral. Here are some more shocking pictures of advanced stages of lymphedema. So why does lymphedema occur? Our lymphatic system is responsible for our fluid regulation or fluid volume balance in our body. It drains about 80 to 90% of the water from our interstitial space, which is the space between all of our cells in our body. Our vascular system only drains approximately 10% of the water in our system. Unfortunately, years ago, this used to be reversed in the old Starling's law. Now this has been revised with new research and knowledge. We know that the lymphatic system is the system that is responsible for fluid regulation in our bodies. When there is a backup or dysfunction in the lymphatic system, that's when the edema occurs. The lymph system is responsible for removing the proteins and water from that interstitial tissue and then returning it to the blood circulatory system for elimination via the kidneys, liver, and digestive system and bladder. I want to quickly talk about water pills. Water pills are something that is often diagnosed or prescribed rather from your physician when swelling is present. And water pills in general help with regular simple edema. And we're going to go through the differences here in a bit. But Lymphedema's characteristics are actually protein-rich fluid trapped underneath the skin. So water spills are really great for getting rid of swelling if it's just simple water. However, we know that lymphedema is not just water. It's also an accumulation of protein. What happens is those protein molecules are too large to diffuse through the holes in the venous system. So those protein molecules get trapped and stuck, left behind. So when the water pills are doing their job, they are doing a really good job of getting rid of the fluid, the water, but they're leaving that protein stuck behind. And what happens is that water loves protein. So therefore, it becomes a vicious cycle of the water gets removed, but the protein gets left behind. But water loves protein, so more water just comes back to those protein molecules. Your lymphatic system is the only system that can get rid of those protein molecules. Therefore, if there's a true dysfunction in your lymphatic system, water pills, unfortunately, are not going to help. They're going to help get rid of simple fluid, but they will not help get rid of the protein that's trapped and left behind. So we need to treat the underlying problem with the lymphatic dysfunction. Water pills can help, but they don't solve the problem. We also have to be careful not to overtax the heart. So why does lymphedema occur? There's two types of lymphedema. Primary lymphedema, which is a congenital defect from birth. You are born with a lymphatic system that is either missing or partially missing or dysfunctioned. There's also secondary lymphedema, which is caused by an insult to the system, the lymphatic system. And this can happen years later. So a great example of this is removal of lymph nodes and tissues from breast cancer or any other surgery. Unfortunately, you can still develop lymphedema years after the initial surgery. It doesn't have to be something that you're only looking for signs and symptoms of within that first year after surgery. So secondary causes of lymphedema could be breast cancer, removal of lymph nodes and lymphatic tissue, trauma, surgery, cancer, radiation, infection, and obesity. And with breast cancer, unfortunately, those folks have a 28% risk of developing lymphedema. So talking about that lymphedema from breast cancer, because I think it is so important, if caught early with treatment, you can often get a 50% reduction in limb size within the first 1 to 3 months. What will eventually happen is those patients will see a plateau in treatment where their limb is no longer reducing. However, the exciting part is we can wait a while after you have plateaued because the lymphatic system net regrows, just much like our nervous system. It just grows very, very, very slowly. So we can have spontaneous reduction of a limb after after breast cancer and lymphedema diagnosis after years. So even though you might be going through treatment and you have kind of plateaued and are where you're at, that doesn't mean that's where you're going to end up. So that's good news. I want to talk about edema so edema would be simple edema versus lymphedema. So edema is actually a symptom. It's a fluid accumulation in the extracellular space. There's usually no increased risk of infection. And after successful treatment of whatever underlying disease or condition or injury, there's usually a complete resolution of edema that is expected. Whereas lymphedema is an actual disease. We know it's high protein rich fluid accumulation under the skin and in the tissues, which can lead to tissue proliferation or fibrosis and skin changes. There is an increased risk of infection, often cellulitis, because bacteria feeds off of that protein-rich fluid. They love protein, and so bacteria is often fed by that protein, causing infections and infection risk. And we know lymphedema is chronic. I'm going to talk about a couple variations that you can see with Lymphedema. Phlebolymphodema is a condition of mixed venous and lymphatic insufficiency. It's usually not recognized and treated, or if it is, it's more seen as chronic venous insufficiency alone. In the presence of venous hypertension or problems with your circulation in the lower limbs, what happens is the increase in lymphatic flow becomes greater than the ability of the lymphatic system to transport that fluid. So hence there becomes a failure in both the lymphatic system and the vascular system or the venous system, which a failure in one system often gives rise to an additional burdening to the other system. So this is a condition of mixed chronic venous insufficiency and lymphatic insufficiency. And these folks have very distinctive looking limbs. Chronic venous insufficiency is caused by a dysfunction of the one-way valvular system in the deep veins of the lower extremities. So you can see in this picture is a healthy vein where the valves are nice and tight together, which prevents backflow of blood. In a diseased vein, what's happening is the vein walls are weakening. These valves are then failing and no longer becoming close together in proximity, which allows regurgitation and backflow of blood down into the limb. This leads to blood pooling in the limbs. Valvular problems result also in a decreased cellular oxygen and nutrient distribution, thereby affecting skin health and wound healing. So people with chronic venous insufficiency usually have problems with slow healing and are prone to developing long-lasting wounds. Typical skin changes include what we call hemosiderin staining, thickening and or hardening of the skin, swelling, pain, and heaviness in the legs. This hemosiderin staining this is a classic picture of the hemosiderin staining. It often looks like an inverted champagne bottle with this red rusty color under the skin. What's happening is the hemoglobin in your red blood cells is responsible for carrying oxygen from your lungs to other tissues. But when the red blood cells break down, the hemoglobin releases iron. So that trapped blood that's pooling down in the legs is now leaking out that iron and staining your skin, causing this hemosiderin staining, this rust-like staining beneath your skin. And the last thing that I want to talk about today is called geriatric ankles. This is a lymphedema that develops due to a limited mobility, cardiac compromises, and that venous lymphatic overload. Immobility in folks can lead to chronic blood pooling in the legs, venous hypertension, which then facilitates and enhances that lymph formation, leading to increased swelling. So this is a symmetrical water accumulation in the lower legs. So this is your folks, often geriatric elderly folks who are not moving around as much. They are maybe wheelchair bound or bed bound. Their legs you're not able to use the muscular pumps in their legs to evacuate some of that fluid and blood in the lower legs. So some things that can be done to help this is to make sure that these folks have proper positioning and pressure relief. If they're in a wheelchair, that their legs are on the leg rests in the wheelchair to avoid kinking of the lymphatic system on the backside of the legs. Proper cushions, walking programs, regular exercise, and reducing sodium intake. Anything really that stimulates the lymphatic flow. So lymphedema in itself has a lot of variations in its disease, but the most important thing about lymphedema is catching it early so that treatment can begin and it does not affect the quality of your life. Stay tuned where I'm going to talk about how to diagnose and treat lymphedema. Thanks for listening.